On the Scene video coverage of AHA 2012 is supported by Pradaxa.
Well, here on the Scene at AHA 2012 is another late-breaking clinical trial, the Arctic trial, that looked at strategies of antiplatelet testing and treatment in patients undergoing elective PCI. And interestingly, a strategy of testing for both aspirin and clopidogrel resistance with adjustment of antiplatelet therapy in that treatment strategy group, there was no benefit seen over standard treatment with routine antiplatelet therapy. This was a study of just about 2,000 patients where it was that strategy of standard of care, clopidogrel and aspirin, and routine follow-up versus testing both pre-PCI after the initial antiplatelet therapy and then also at 7 to 14 days with adjustment upward in the intensity of antiplatelet therapy. So for aspirin non-responders, the dose of aspirin was often increased. And then for clopidogrel non-responders, the dose of clopidogrel could be reloaded or increased at the follow-up phase, or switching to prasugrel, not done very much early, but done about 15% of patients later at time point, and the use of 2B3A inhibitors at the acute setting. That was done in about 80% of the clopidogrel non-responders. But interestingly, that strategy of being much more aggressive really didn't translate into any benefit whatsoever, with the hazard ratio actually be a little bit adverse, but not any advantage of that testing and adjustment strategy. This comes on a background of the Gravitas trial that did testing for clopidogrel resistance and doubling the clopidogrel dose for the non-responders, a slightly different strategy, but that also didn't work. And so I think we need more work on that approach of testing and adjusting. Fortunately, we do have large outcome trials of simply using more intensive antiplatelet agents, and so both with prasugrel and ticagrelor in the Triton and Plato trials respectively seem to be of benefit in ACS patients as compared with using clopidogrel. With prasugrel, no benefit seen in a medically managed or conservatively managed group in the Trilogy trial, but a clear benefit in PCI. And with ticagrelor, both in the ACS setting of with or without an invasive strategy, an advantage. So intensive antiplatelet therapy clearly works, but the adjustment and testing strategy really hasn't panned out so far, and more work would be needed to evolve that approach. So for CVN and On the Scene, I'm Chris Cannon.